Honorable ML Sonkarji, his dynamic son Vikas, Dr. Vikas Swankar, currently chairperson, Dr. Gulati, Vice Chancellor, Dr. Kapoor, Pro VC, all the esteemed guests on the podium, and the hero and the stars of today's convocation are bright youth, ladies and gentlemen. First of all, I would like to congratulate Mahatma Gandhi University of Medical Sciences for their 7th Dikshant Samaroh. As we can see, it is evident that the Swankar family has toiled so hard over the last 2 decades to bring this university to such a level where all of you young boys and girls would be proud to be entering the practice in the medical field, and also I'm certain that today is a day where you will be very, very proud of yourselves. Are you all very proud of yourselves today? Yes. No, that's very small response. Are you all proud today? And are you grateful to your mummy and papa who have supported you, and now today you are going to be able to stand on your own feet, and you will have the opportunity to show the success story to the whole world by your services to the suffering of humanity and mankind. When a patient is in the OT, when he is going to be cut open, I'll tell you one thing. He thinks about God, his confidence in God. But that patient, I can assure you, treats you as a demigod, that his or her life depends in your hands. Such great is your responsibility. A life you are saving, a life of good health and prolonged age you are trying to ensure. I feel this is one field. I don't think there is any field where there is so much satisfaction you can get than the medical field. I have one major request or plea to all you students, that please understand that the medical world is also turning very, very dirty. Fake medicines are being produced. The salts in them are being reduced. I would just say that today, when you all are graduating, when you are getting your degrees, you are getting your medals, your meter of your earnings are going to begin. Promise yourself, promise to God, that you will serve humanity honestly. You all will serve humanity honestly? Yes? Cross your heart? You're not crossing your heart. You must. Because this is one field where human suffering, it is the greatest service I can tell you, you can do and God has given you the opportunity to perform is to help reduce, eliminate human suffering. It is a pleasure to be here because the kind of dedication the Swarnkar family in the last 2 decades, whatever it is hard work, blood, sweat and tears, loans, risks. To be at this level, it's taken a lot. And when I heard that there are 700 doctors, 6,000 staff, 5,000 students, and with all the modern technological, you have to keep in pace with technology. And that's what I find. I notice that Mahatma Gandhi is exactly doing. The cyber knife, the latest PET scan machine. And I'm very glad that Dr. Swarnkar, you have signed MOUs worth 1,500 crores. And I can assure you that our policy of hand-holding, of taking you to the finishing line without any bumps, without any trouble, because this is my department. And please let me know if there are any stumbling blocks, any bottlenecks, any hurdles. I will only be too glad to help you all. Well, I'm not doing you a favor, it's my duty. See, now, any economy, any country, when you evolve, when the years go by, and countries are getting more modern, the economies are growing, there is a transition that takes place. The transition is from government enterprise to private enterprise. The government has to let go. The government has to allow hospitals, nursing homes, diagnostic clinics to mushroom. And this example you can see in Rajasthan, it's already prevailing. The Ma Yojana, the Mukhyamantri Arogya Ayush Yojana jo hai, it's a very big yojana. And what we are trying to ensure is the fact that our society, our public, should be able to choose their own doctor and their own hospital under the umbrella and coverage of insurance. Free medication or subsidized medication. And I was very glad to learn to Dr. Swarnkar that 70% of patients or the services here are through My Yojana. I told my CM, I told him, मुख्यमंत्री जी, अब जो है अपना पैसा है ना, अब ये हमारे सरकारी हॉस्पिटल बहुत ज्यादा, अब झोंकना बंद करो आप तो माँ योजना का जो दायरा जो है, increase that, and everything medical health is going to blossom in this state. We are trying now, because of the Ayushman Bharat portal, we are soon going to allow other states, all pan-India, to be able to come into Rajasthan and get treated in our empaneled hospitals. That's going to be a very big boost to all of you. Dr. Swarnkar, I belong to Nagaur district. First time I was MLA from there, 2003. तो नागौर जो हेडक्वार्टर जहां हम जाते थे, सब लोग वहां पर they had to go even for a CT scan. Anything above X-ray they had to go to either Bikaner or go to Jodhpur. Just 6 months back, I went to Nagaur to receive our Chief Minister during the Lok Sabha elections. His chopper had developed problem. He was 3 hours late. So I said, okay, हमारे पुराने कार्यकर्ताओं को थोड़ा मिल जाते हैं शहर के अंदर, on the periphery outskirts. And as I drove along, I saw hospital, diagnostic clinic with signboard saying MRI, CT scan. And I was shocked. I said, my God, look at the mushrooming of private enterprise. And what happens is, when this happens, you are giving service to humanity on a large scale all over the area. And this is what we need. Bigger scope of Mayojana, more packages, more empaneled hospitals. Because even in America, you have 3 players. You have the patient, you have the empaneled hospital, and you have the insurance agency. Everything is between them. The government doesn't intervene. Our job is to serve where in the villages where private enterprise does not find it feasible to operate. One request I would like to make to Vikas and Dr. Swankar, one yojana which is very close to my heart and I am on the threshold of getting it going. I wish you all can also help us. I want to bring to your notice that 70% of our population today lives in villages. And that 70% which live in villages, 45% are women. My constituency is a totally all only villages, no townships, no cities, no bada kasbas. And as politicians have to, one of the major duties we have to fulfill is attend weddings, social functions and bereavements. When I attend bereavements, I've noticed that I'm attending a lot of bereavements where women are dying of cervical cancer and breast cancer. Because neither are there clinics there, neither is there testing. And I feel that women are a very major part of our society. They produce children, they rear the children, and they produce the future of India. 1 or 2 hospitals have started. They've made these buses, what they call vans, and they have pap smear also there, and they have mammography also there. And I am trying to make a proposal that you can adopt a tehsil or a district. Your cost is going to be your doctors who go there on the camps, your fuel, maintenance of the vehicle, slides. We will give you all the manpower, the ANMs, the doctors, the lab technicians, whoever you want, who will handhold you and get you to the patients who have to be tested. This is my dream and a project which I'm embarking upon, and I just want and I hope you have dynamic people like Vikas here, and it's great, Vikas, also to see your father being there, just a invisible hand in the background, giving you an opportunity in front of his eyes to see you blossom and take this institution high, much higher than every father wants his son to be much bigger than him. And do let me know that Mahatma Gandhi University, if you can also participate, and giving you the manpower and the doctors in the field, that is something which is a very major issue which you don't have to tackle. Once again, I'm sorry I've taken so long. My apologies that I have broken the chain and I've jumped the queue. Today is our Lok Sabha Speaker Om Birla ji's daughter's wedding reception, and we are running quite late and have to drive all the way to Delhi. So I request Dr. Swankar, can I just jump the queue and can I give my blessings to all the young doctors and the lifesavers, as I call you lifesavers, and let's work together. Let's work for a better India. Let's work for better health. And Dr. Swankar, I'm always there for you. Just anytime, anything, it's my duty to help you. I'm not doing you a favor. And I just pray to God that the trajectory which you have taken, the way you are rising, the way you are serving humanity and educating all the young people to be able to get their license and in a quality university, I think you are doing a lot for society. And I request all you youngsters, the future of India, the hope of India, all the best, and my congratulations when you meet your parents who are here, who helped you, and my heartiest congratulations on this proud day. Jai Bharat, Jai Hind.